Dr. Darien is back, and we are talking about screening for colon cancer.
Yeah, more options for patients. So the FDA has approved a new screening test. It's called the Shield blood test to help those who are looking to get screened for colon cancer. This is a blood test that you can take that can relatively accurately see if you have a diagnosis of cancer. I will say that this is not the gold standard, which is a colonoscopy, but again, what we were talking about before, it improves screening access for so many who might not be able to get a colonoscopy.
And how do you get this screening? What does it entail? Yeah. When should you get it? All those things.
Well, this is already available, commercially available. But the problem is that it wasn't FDA approved, so therefore people had to pay out of pocket. And that can increase as much as $900 for just a test. So this new FDA approval allows private insurers as well as Medicaid to improve their possibility of covering this, more likely to cover it. So you should just ask your primary doctor, have these conversations around the age of 40. If you have a family history or a personal history of cancer, you might want to start earlier. But it's all about having the discussion first to see what your options are.
Yeah, colonoscopies are not really a lot of fun if you've ever had one. This is a blood test, so is this just like you give some blood and that's it?
It's just a simple blood test, and I will say that it's compared to a colonoscopy, it's not as accurate. We consider colonoscopies to be the gold standard, meaning that that's the one that you want to use if there's any concern or possibility that this test might not be accurate. But I think for those who might not want to go throughout that process or might not have access yet, again, this is a great option.
Okay. All right. Dr. Darien, thank you so much.